how we plan for perfection. Hi, I'm Dr. Bobby Chhoker, general, cosmetic and implant dentist based here in Sydney. Come on a journey with me as I show you behind the scenes in my life and in my clinic. I'm an educator. I have been placing implants for more than a couple of decades, and I teach my students that, in my opinion, implants should be placed in a purpose-built surgery, and that they should not be placed really in a general dentistry surgery, because general dentistry and surgery are two different things. I'm going to walk through some of the toys we have here to make sure things are really predictable, and if they're really predictable, we keep you safe, you get a very high standard of treatment, and it has longevity, and that's what everybody wants. This is probably my favorite bit of equipment and most important bit of equipment in the surgery. This is a CBCT X-ray scanner. So you're used to having those little X-rays in your mouth that take a very close-up of the teeth that allows to see decay, some areas of gum disease. And quite often you're put into a machine like this that revolves around your head. That's still two-dimensional X-rays. They're showing everything in 2D. It's a bit like seeing the front of the house, a facade, and not knowing what's behind it. So it is essential, in my opinion, for every single case, whether even it's a single implant or a full mouth rehabilitation that we do here, to have a 3D CBCT such as this so that you can plan appropriately. So what this does is take that wraparound picture, but it gives you a 3D format. And what that means is that we can take individual slices from that format, and I can locate exactly where nerves are, where vital structures are, where sinuses are, where the roots of other teeth are, which is important. You do not want to have complications and risks of having an implant placed by not measuring that and knowing where these structures are. Our actual implant machine. Firstly, implant success is based on how stable the implant is when we put the implant in. We call this primary stability, and this machine measures it specifically. It also gives me an indication of the quality of bone, and that will specifically change the way that I create the osteotomy or the hole for the implant. So it's very important. And that's making sure that we're not putting too much stress on the bone. We're making sure that we're very minimally invasive, meaning patients have then fewer post-operative complications and things are smoother. Equally as important is the machine below it, which is a piezo. This machine allows me, particularly, let's say I have a case where we don't have a lot of bone and we can't add bone for whatever reason, and we know there's a major nerve there. This machine allows me to go down and create the hole to put the implant in without damaging the nerve or getting too close to the nerve. So it's very, very precise and safe. What it also does is it specifically allows me to remove tissue, soft tissue that's not good in there, that's grown from an abscess or an infection or anything else, and to take only that away and preserve any healthy tissue. So ultimately what it's doing is take away the bad stuff without damaging any of the good stuff. I'm super excited today because we have some new technology. Well, we're upgrading technology. We have the 3Shape Trios 3, an amazing scanner, one of the best scanners in the business. So this has so many uses. First and foremost, for implants. For implants, not only can I take the 3D scan that I talked to you about before, the CBCT, if I then take a scan, this scans the mouth and gives it actual 3D real data of your teeth, where they are, position, shape, size, color, everything, and we match the two together, we can then predict exactly the orientation, depth that we want of the implant so that the tooth we put on top is exactly matched with the other teeth and your bite. So we can actually predict where we want the tooth to be and basically plan from the top down and build from the bottom up. One of my other favorite uses of this is cosmetic smile makeovers. It may be the fact where I'm planning a whole jaw on implants and we want to get the shape of that bridge right. We want to make sure we've got the characteristics right, that it looks like the person, it fits into their mouth as if it's part of them, looks completely natural. In the same way, somebody comes to us for a cosmetic, a smile makeover, whether it's crowns or veneers, we can take a scan with this and almost instantly show on screen what they would look like. And at the same time, we can have a chat with the patient and talk about shape, size, length, characteristics of the teeth that they want from a library. We import those and we'd put them up on the patient's scan so that you can have a look at what they're going to look like. Now, that is amazing. Precise and predictable implant treatment is about being really, really detailed. We have the technology here so that you're kept safe, you're provided with the highest level of care, and you're provided with something that's predictable and therefore has longevity. We are running at the moment a free online consultation. So all you have to do is have access to a telephone, a smartphone or a computer. We can either ring you and have a chat over the phone, or alternatively, which is what I prefer, is to have a face-to-face on FaceTime, Skype, Zoom, whatever you prefer. So let's get that conversation started and let's see what we can do.